Hi, welcome to the Dr. Dana Show. I want to say a few words about my next guest. Dr. Cho has been an icon in the Korean community and brought a lot of health and benefits to the Korean people, especially in functional medicine. He originally started out as a chiropractor, worked for a while, we're going to hear his story, and he got really, really big. He has over 400,000 people on his YouTube page, and he's doing a lot with Personalized Nutrients, an amazing company making very targeted, specific nutritional protocols for a lot of people here and in Korea. So without further ado, let's introduce Dr. Cho. Thanks for coming on.
Thank you for having me on your show, Dr. Chu.
Pleasure. Well, I've known you for a while, and I know you have a lot of influence in the community with the Korean patients, and I've actually seen some of your patients. So I was just wondering, how did you get started in all this, and how did you get so big? Because I know you're doing a lot of shipping, right?
Shipping, yeah. Somehow shipping is involved, but which was never our intention.
Okay.
Basically, I'm a chiropractor, and other than adjusting, we also do the nutritional counseling.
Okay.
And back in my times, you have to do the continuing education, right?
Right.
And then there are some nutritional courses start.
And you
They
like
start
those?
introducing it. Yeah, I somehow got into it, and then my dad was diagnosed with cancer in 2006 while I was first getting in touch with the functional medicine.
Right.
Yeah, and he has a liver cancer. The size was big, and outlook was not good. So Kaiser doctor was saying he might have like 7, 8 months. They want us to prepare,
Right.
which they rarely give out the times, but back in time they did. Yeah. And then the doctors they all got busy. But when I look at them, they're busy because they try to find out whether this patient is candidate for the chemotherapy. Can he handle the
Okay.
chemotherapy? Or is he candidate for the surgery,
Yeah.
But because of the size and the shape and everything, the location, the surgery was not an option. Yeah, and then somehow chemotherapy is not a viable option for his type of cancer.
Right.
Yeah, but then they all got very busy doing testing, everything, try to find out what they can do for him. But then nobody was asking how he eats, how's his stress level, the workout, nothing about lifestyle.
Right.
So there's like big disconnection. So they do what they can do the best, but then might not be the best option for the patients. But including myself and my dad, a lot of patients think the only option is the what is offered at the hospital,
Right.
right? Which is standard of care, surgery, chemotherapy, and radiation.
That's all.
Other than that, doctors, legally they can do it, and then their educational background, they can do it, and they don't want to get into it. People even can't ask a doctor about like certain nutritional supplements or the food.
I know.
And
It's
the
sad.
answer will be always like, don't do it, right?
Right.
Without without real background or any research, just they all deny it. So, but some people, patients, they do what doctor says do, and they go home, they do
The natural
what
one.
they want to do,
Right,
right? So
right.
I think it's problematic. It's not all ideal. Yeah, and then at the time I tried to help my dad, so I got more involved into like studying more deeply about the nutritional supplements,
Sure.
functional medicine, lifestyle medicine. Try to get into that. Yeah. So I got more education. Yeah, and I was start seeing my own patients with start counseling them on the nutrition side. Yeah, and then it was like what 15, 16 years ago. No, almost 20 years ago. The functional medicine start getting more. How do I say more? Not mainstream, but it's more like widely accepted, right? Yeah, start having more tools, more tests to find out what's deficient, what could be the problem.
Right.
We could look into the different part of the body. Yeah, there's more tools come along, and then I start seeing more patients, and I was treating Korean-speaking patients, Korean
Okay.
communities. Yeah, they are not well represented, and they're not well covered by the benefit of the
So
nutritional
you need a lot of
function.
education there.
Yes. So I start seeing them, but as you do the functional medicine and the nutritional health requires a lot of time, right?
Yeah.
It's not just you check the lab and then prescribe the medication accordingly, but then you have to go into the details. You have to talk with them, right? You have to understand what's going through. So it's always taking time, right? And then a lot of times I have to explain to them because they don't naturally get it, right? Yeah, they need a little bit of explanation. So which was so hard, I can't do it every time, right? Time consuming.
Yeah.
I mean, each patient I spend more like 1 hour, sometimes
Okay.
over an hour. So I started doing filming because there are always things that I have to explain to them.
Oh,
Like,
interesting.
I mean, if patient has diabetes, I have to talk about insulin resistance, right? Because I have to talk about the cause. And so I start making videos about insulin resistance. I try to put it on the podcast because it was back in time, podcast was huge. It was before the YouTube came along.
Oh, okay.
Yeah, so I was just recording it. No,
Yeah.
no video, no fancy, nothing. Just recording.
So
Yeah.
just the icon like has podcasts and you listen in your car, that one?
Yes.
Okay.
Yes. But I didn't know how to upload on podcast.
Yeah.
But then somehow I was able to do it on YouTube. So I start putting it up on YouTube. Yeah, and then
In Korean? It's all in Korean?
all in Korean for Korean.
Patients, yeah.
There's a lot of other contents out there for English-speaking people.
Right.
You know, if they have a will, they can find it.
Right,
But
right.
for the Korean people, they don't have it. So I did things in Korean, get them the information, put it on the YouTube because that's the only platform that I can handle.
Yeah, yeah.
And then I told Mr. So and so, you go listen to this YouTube. Yeah, it's gonna benefit. It's gonna help you. So I can save a lot of my time explaining to them one-on-one, right?
That's great. Yeah.
But then, so all my YouTube was like a podcast. It didn't have any videos. It's only all audio. And
Really?
it was still
On
cut.
YouTube,
Yeah,
just the audio?
yeah, because it was back in time. It was okay.
And people listen
Yeah.
to it?
People still listen to it.
Okay.
Yeah, now you can't do it, but
Yeah,
back
yeah.
in time it was okay. And it was only intended for my patient. I didn't have a plan to have running the YouTube channel. I just was using it as a tool.
Okay.
But then people in Korea start listening to it. Yeah, which I didn't expect it.
Mhm.
Yeah, and people in all over the world, like from China.
Okay.
No, I'm saying Hong Kong or Taiwan.
So wherever
Yeah, or
Koreans
Japan.
were.
Yes,
Or
everybody
they
was
speak
listening
Korean
to
at
it.
least.
Yes,
Yeah, yeah,
yes.
okay.
Because of YouTube algorithm, they start like going over.
Oh.
Yeah, there's no boundary, right? It goes everywhere.
That's cool.
So people in Korea start notice it, and then I came to the next step. Wrote a book about
Really?
the nutritional health and the functional medicine because there's nothing exists in Korea. Nobody. I mean, there's a group of doctors who do the functional medicine, but it was very small.
Right.
It was not very well known to the public. It was just like more like a study group of a small doctors who are
Here or in
interested
Korea?
in Korea.
So there are no Korean naturopaths or anything?
Now they do.
Oh,
Now
this
they
is
are,
back,
but
okay, a
back
while
in
ago.
time,
Okay.
very rare. Very
That's
rare
interesting,
to find.
okay.
Yeah. So I wrote a book, and then the book was well received in Korea. So it became the instant bestseller. 180,000 copies.
Wow.
Yeah,
Good.
it was book big for
That's
the time.
great.
Yeah. So the YouTube came along, and then YouTube got huge. So my channel started growing. Now I'm not doing the telemedicine to people in Korea,
Okay.
but then we have like a patient community groups.
Right.
So we like a community group where you can upload your stuff, and then everybody's like discussing it together. So there's a community now, and there's things my patients here, and then there's YouTube, and then the book is a bestseller. What's the next step?
Well,
And
you
then
blew up.
people in Korea ask me they want to get the supplements that I prescribe to
Oh.
patient.
Made in America, the ones here? Yeah.
Yes. So somehow there was a demand that they asked for it. I didn't know how to do it. So there's some certain brands that we usually use, right? So
Yeah.
some familiar brands that prescription targeted
In Korea?
the brands. No, in here.
Oh, right, right.
Yeah.
Like
So like
orthomolecular
Zymogen,
and
Osmoleculars,
Zymogen,
yeah. Like Douglas Lab.
Sure, sure.
I was prescribing those
Best
brands,
companies,
right?
yeah.
So I started shipping it out to Korea, like as if they're my patients. But then the company, they step up and say, it's for the prescription only in the doctor's office. So do
Really?
not ship it out to Korea.
Oh, that's
Because
terrible.
they have a representative in Korea, I think.
Oh, I see.
Like import, export.
Stepping on their toes.
Yeah, yes. So I think maybe complaint was filed. I don't know. So I have to make our own brand, my own brand, so it does not interfere with other.
Private label.
start with a private
Okay.
label, and then it grow bigger, and then now start having more, making my own supplements.
How many supplements do you have?
Like different, what kind of
Yeah.
supplements? I don't even know. I can't count. Like
100 or
it is over 100.
wow.
Because I try to cover like SIBO,
Okay.
thyroid issues.
Yeah.
Yeah, mostly
Diabetes,
diabetes, blood pressure.
like
Those like our
MSK stuff,
yes, right, right,
musculoskeletal
right.
pain and
Yes.
inflammation. Yeah.
So those kind of things, so I try to cover everything,
Mm-hmm.
and I do different combination. I made a combination I suggested, and depends on the age and their condition, we try to cater it and personalize it.
Yeah. Personalized
Yeah, it's
nutrients.
not 100% personalized, but somewhat personalized.
Right.
Yes, try to as specific as possible. So as if I'm prescribing it to my patient here, you know.
Right.
Yeah, that's the service I try to provide. Yeah, but it was nothing was planned. I didn't intend to
Yeah,
be
'cause
a
you could.
bestseller author. I didn't intend to be I didn't want to be a YouTuber. I don't want to be classified as a like influencer or YouTuber.
Oh,
I don't like the term, you know. I don't want to
yeah,
do
yeah,
that.
yeah,
Yeah.
yeah.
Yeah. I just like a doctor-patient relationship.
You're so
Yeah.
humble. That's good.
It's nothing to do.
But you definitely blew up, and you did. You know, that's amazing how
Yeah,
well you
by the
did.
blessing, yeah, somehow. I mean, I think it's a bless for me and also those people who benefit in
Well, help
Korea.
them comes if they don't
Yes,
have any nutritional medicine, they're just going to be doing drugs, surgery.
right?
It's
It's
just
because
it.
there's another options, you know. I
Yeah.
think it's
You
it's
gave them
better
more
for patients to have
options.
more options, you
Yeah.
know, and choice could be theirs. You know, during the pandemic, like if we wish we all have like different options how we treat this disease,
Yeah.
right? This epidemic. So, oh yeah, it has. During the pandemic, I talked about how we handle the epidemics, you know,
Okay.
the government's like the mask mandate, you know,
Right.
forcing people to stay at home. Later, the vaccine came along, and then they tried to mandate it. It wasn't mandated in Korea,
It was
especially
or
for
wasn't?
children. It was,
Everybody?
which I believe it shouldn't be. It doesn't matter how great the
No.
vaccine is,
No.
and it was experimental vaccine that we all know right now. So it was only approved with a special. In a normal circumstance, that vaccine never would have been approved, right? But it was approved because of the
Yeah,
special
there's a lot of
circumstances.
problems with that right now.
Yeah,
Seeing a
so
lot of.
I had to talk about it, and then I was like, my YouTube was almost got shut down.
Oh, really?
Yeah, I got 2 strikes. If you have 3 strikes, your channel will be gone.
Oh my goodness.
Yeah, I got 2 strikes, but I still have to talk about it because so I could sleep. I could go home and sleep, you know.
So you help the people.
I try to, yeah, I try to give them different information, you know,
Right, right.
not one-sided information. I mean, it's okay to talk about vaccine. I understand the pharmaceutical companies talk about all the greatness of vaccines only because that's what they're a for-profit organization. That I understand that they can do their own advertisement, but then if it's the government, the healthcare agency, it should be very neutral. The information should be very neutral, but it wasn't the case.
No.
And then there's a lot of different studies out there which was not very well represented
Right.
on the media. So I just have to talk about it. So just give people the option, you know.
Well, just talk about it and write it in Korean. Nobody will bother you then. That's good. No, I'm
Yeah,
glad you did
yeah.
that because not many people are speaking out and talking, you know, what's the other side of all this.
Right. I think it is benefiting people, you know, just giving all
To
different
give them the
options.
information.
Yeah,
Yeah,
exactly,
yeah,
right? This is age of information. Now ignorance is your choice, you know?
Yeah.
But then there's a little, some of the information has been canceled or shut down. Like the media
Yeah,
is not
it's
covering it. I
yeah,
don't
no,
think
there's
it's
a
right.
lot of
Yeah,
problems with that. I
yeah.
think maybe that'll stop soon. Maybe we have a new
Hopefully.
era coming in, hopefully. Yeah, that's interesting.
Wishing the best, you know? Yeah. So that's how it became.
So how long did you actually practice chiropractic medicine? You're cracking,
I
racking, and
do.
cracking them?
I do adjust. I do.
Even now?
Even now,
Oh, okay,
I
okay.
do adjust, but a lot of my practice is toward the functional medicine
Okay,
side.
cool.
Yeah,
You know, we as naturopaths were taught, I mean, almost every single semester we had a class in
right.
chiropractic.
Yeah,
And we couldn't call ourselves chiropractors because, but I mean, a lot of people, I don't like it. I don't have great spatial relationships with things. I use more of my brain, like biochemistry and homeopathy. Those are more
sure.
my
I respect so
fortes.
much about naturopaths because if I knew it, it was I don't know. Back in time, maybe it was there, but probably it was very small, not as big as right now.
Right.
Yeah, so I didn't even know that the school
You
exists
think
in
you would
San
have
Diego.
gone? Would you have gone?
Probably,
No, Bastyr wasn't in San Diego yet. It took a while. I
right?
don't remember what year. It's been 10, 15 years though, but
Right.
they weren't like when I first came here in
Yeah.
2005, they didn't have a school in San
Yeah,
Diego yet.
unfortunately, like I didn't even know it exists because it
Huh?
was in 90s and when I went to school. So
Oh, in the 90s?
yeah, it
Okay.
wasn't there for me somehow. Yeah. If I knew it, it would be great. Yeah.
That's cool.
I think naturopaths can benefit a lot of people.
Yeah, depending on what you study, what kind of, they give you so much information in school and a certain amount sticks. And then you go out there and you see what else what resonates with you and then
Right?
what you want to excel in. And that's
Uh,
kind of what I did.
and I think a lot of things should be covered by the insurance. That's the one big problem
Yeah, we
right
have such
now,
an issue right now.
right? The
So,
test and
yeah,
even supplements. There's no rule why does only the pharmaceutical medicine should be covered by insurance.
I agree.
Who decides that rule?
Yeah,
Yeah,
they did probably.
right.
Or, yeah, I don't know. They have a lot of power right now.
A big
So I
lobby.
think
Other
there's
than that,
too
they
much
can't
power in
explain
that
it.
group.
Yeah.
So we need to have all the choices out there. It's like I was joking around with my previous guest today. Remember the Flexner report
Yeah.
that
Back in
Rockefeller
times.
did or Rockefeller
Right.
had someone do? Well, I was joking around like now maybe we'll have a reverse Flexner report,
Uh-huh.
like the other way.
I think it's about time,
Like all the
right?
places that are doing harm and the research that's not accurate, or people are doing their own research.
Right,
That's the
right.
first thing you need to get rid of.
Right.
Because if you,
I mean, when
so
back in time, like 15, 20 years ago, when we talk about leaky gut syndrome, it's like it's quackery, right? It's not science. It doesn't exist.
yeah,
But then now, even every mainstream doctor, they all acknowledge it. Even vitamin D, they test it and they prescribe to the patients.
they get some of it's coming mainstream, which is really good.
Right, that's a good
Definitely.
sign, right?
Yeah.
But I think it should go a step further. It should be available with the insurance, so a lot of people can benefit from it.
Oh, I
And more
totally
information
agree.
should
At
be,
least
yeah.
peptides are similar. They're close to drugs in the power, but they don't have any side effects.
Right.
So they should be covered at least. And hormones are kind of hit and miss. Thyroid, nature thyroid's getting covered everywhere.
Right,
That's a
right.
big thing.
Yes.
But the patients really don't, they have to pay a lot. They don't
Uh-huh.
get to use their insurance very much when they come to a naturopath, which is
Yeah,
unfortunate.
that part should be improved, definitely. I hope RFK Jr. does. He talked about we have an epidemic of metabolic disease, right?
Metabolic disease,
Everybody
yeah.
agrees that.
Yeah.
I mean, it's more problematic than the COVID because more people
Yeah.
suffer from diabetes.
We have a lot of problems
Yeah,
with the blood
and
sugar.
I call it epidemic because it is transmittable because of the lifestyle from parents to children and peer to peer. And you know, if someone try to eat healthy there's a group of people
Right.
like in a company, everybody's eating junk and no workout, and that's the normal. And one
Donuts.
person who try to eat right, try to eat healthy,
Yeah.
I mean, he will look like a weirdo. And then people influence each other. So,
Yeah.
like what we think like is normal food, normal feeding right now might be problematic.
Mm-hmm.
So it is epidemic, especially
Oh, I see
from
what you're saying.
parents to children,
Peer pressure epidemic.
or parental.
That's interesting. I never
Yeah,
thought of it like that.
share the same type of lifestyle, same type of food with your family. So that's why if your father's fat, kids is fat, you can see that. So and the diabetes,
Well, like when we have a
it runs in
family,
the family, but
yeah,
it's not DNA, right? It's more
we
like
have
a
to change
lifestyle
the whole
that has been
family. A
shared.
lot of times the mom will come in and they'll bring a kid, or just the mom will come first, and I'll change the diet and we'll change everything for her, and then she starts doing great, and then she starts using that for the rest of the family. So that's
Right?
pretty
Yeah.
cool.
Once the mom is awake,
Yeah.
she's gonna do like more strict about it.
The mom's the
with their
best because
kids.
she wants to check. She wants to make sure she has the time.
Right.
Even if she works, though, they're
Yeah.
just different than the dad. The mom's really on top of it, and some dads do really well, but the mom's
Right. We complain about like the food industry, the FDA, but then if people are awake, we have a choice. Nobody's forcing us to eat the donuts and the latte, right?
Right. They're not putting in we're not
Right.
being force fed. That's so
Right.
true. Yeah.
So people should. That's why people like you or like myself should put a lot of information, different idea.
Yeah.
I think it is changing, awakening people a little.
Well, that's why we do the show. One of the biggest reasons to get the
Right.
choices out there that they might not see, or things got suppressed or got changed or something happened, and we try to get the truth out.
Right.
So tell the audience like what it is. How do you decide what nutrients you put in each formula, and then where your formula is made, and like if somebody wants to order them, how do they get them?
Well, right now I only do with everything do with the Korean. I do sell and then ship it out to Korea, the supplements online. So it looks like an online business. Yeah, but then like I said, I never intended for it. So we don't really function or work like the corporation, the online sales. We don't have a sales team.
Okay.
We don't have a sales meeting. We don't have a sales rep.
It's just you?
Yeah, and we don't have budgeting, nothing like a normal corporation do,
Right.
we don't. Yeah, it's.
But how many orders are you getting like a week or a month?
I don't know. I can't.
How many people are taking the orders?
That's the problem. We don't do that. I don't.
How do you get? How do you know what the patients
sales
need?
report.
How do you know what the patients need?
I have a patient group, the community, right?
Okay.
They're where people gather together. They put. We do the. Recently we do the squat challenge. We do squat together. You should, like, ladies, you have to work out. If you don't do any workout at all, that's a big problem, right? So we do the sleep challenge. We do the squat challenge, right? Everybody do it together. Okay, if you can't do it alone, do it together. Maybe you will do it. Let's pressure each other. Let's cheer up each other.
Motivate. Yeah.
Yes, motivating each other. So we
cool.
do the challenge and then we do the squat together. And then also people start uploading like individual problem, their health problem, in open space. And some other people could. There's some other Korean doctors involved in the community. So sometimes they get answers. They go to his clinic or her clinic. Yeah. So it's like a little bit
all
of
Korean.
Oh, I'm talking about all.
Okay.
So it's all in Korea. That community is there because the patient group is in Korea, but then I am here in the United States. That's why we need the mediums to the location, or what do you call it, cyber location, online location, to do the communication. So there are people like put their own health problem, like the blood labs. Sometimes they upload it.
Okay.
I take a look at it. I give you a little suggestion. I mean, it's not prescription, because it's never been a consultation, right?
Right.
It's not. I'm not practicing chiropractic or medicine without the license.
Right.
So it's more like suggestions. Yeah.
Cool.
So I give them like this.
What do you think about Korean beef?
Korean beef?
Yes, it's healthy.
Oh, are you talking about Korean barbecue here?
Yeah.
Well, egg and steak is the most nutritious food that we can get, right? It's like a multivitamin.
As long as it's made the right way, as long as they grow it and they don't put
Yes,
chemicals with it.
We want it to be like free from the antibiotics, from the
Bovine growth
hormones,
hormone, all kinds of
growth
stuff.
hormones, and then we want it to be grass fed.
Yeah.
It's all ideal, but still, even without, I don't know about the hormones and the antibiotics. I think it shouldn't be there.
No, not at all.
Which I don't. Only grass fed I eat at home, but when I go to outside, or let's say Korean barbecue or steak places, you can't pick that, right? So
you don't know.
But still, beef I think is very forgiving. Yeah.
Beef's a good food, and I think it's gotten a bad rap over the years, but that's because everybody thinks cholesterol causes heart disease, which we all know it doesn't.
Right.
So
same thing as the egg, right?
Yeah, a lot of people. Yeah,
egg is a superfood.
That's all because it raised cholesterol. Well, if your cholesterol isn't at least 250, then you're not going to be able to do the reactions in your body.
Yeah, if your cholesterol is high, you have to ask your doctors if your fat metabolism is okay, if their insulin resistance is okay. The other factors matters. It's not just the LDL alone. It doesn't give you any information at all. But that's not how the medicine is practiced.
It's changing slowly, but
it
takes a long time.
I took the course at the Stanford like last year.
Really?
The nutrition and the heart health.
Okay.
And there was a discussion about it. The doctors are not prescribing enough statins. Only like 40% of the patient who should be on statin is getting statin drug based on the pharmaceutical standard, right? But it is happening because, first of all, a lot of patients not getting the statin prescribed because doctors are not prescribing, not as much as before. And the doctors are doing that because when they prescribe, people are not compliant. They're not eating it. They're not taking it. Either that or they take it, they come back with a lot of different problems, side effects.
Yeah.
And giving
I've seen a lot
doctor
of
a
side
lot of
effects.
giving doctor a
And
lot
there's
of
no
hard
benefit
times,
at all. Even
right?
one doctor talked about possibly 1% to stop any kind of event, like a myocardial, like a heart attack.
So doctors are hesitating. So that report was actually like doctors should prescribe more. That was the motivation of the study. But then it is happening.
Yeah, well, there's a lot of studies that are completely debunking statins.
Right.
And so I would be really careful with that.
Yes.
We sometimes use red yeast rice in our practice if the cholesterol is like over 300-400. But I'm still, in the 1970s, the cholesterol of 300 was normal.
Right.
There's a lot less heart attacks back then than there are now.
I mean, same thing with the blood pressure. It just have gone down over the time.
Well, blood pressure can be detrimental. If it's high all the time, you can get congestive heart failure, or you can have a lot of problems with your heart muscle.
But then the normal level is got lower.
Yeah.
Yeah.
Well, it's good though.
Because they try to maintain like 140 before, back in times. When they prescribed the medication, it didn't benefit anything.
Okay.
It didn't improve the statistics.
Interesting.
So they even lower, try to keep it more tight, hoping that it gets better. I don't think it will get better.
What's in the future for you? What do you see? I mean, all these things kind of happen by chance or just the universe, and then what are you going to do with? Because you've done pretty well, you made some money, and what are you going to do with?
No, it's not about money. Because it wasn't my plan.
Okay.
Yeah. So and it probably never will be. Yeah, making more money or growing my company is not the goal. Maybe try helping more people. Maybe
That's what I mean.
yes.
Like now that you have this, what are you going to do with it?
Yeah. What I'm trying to do, what I want to do is, I want to introduce more of the functional medicine that's going on here in the United States to duplicate it in Korea.
Okay.
Like the health coaches, there's a courses for health coaches, right? And then you can become health coach. You can help a lot of people.
So are any of those doctors, can they come here and would they want to and go to like, Institute for Functional Medicine or A4M?
Right.
Kind of start with the doctors.
Yes.
If they know it, then as long as the government's okay with that.
So I have a lot of friend doctors in Korea. They're all medical doctors, but then they interested in functional medicine.
Okay, good.
Yeah.
So it's growing.
Yeah, they have an academy like functional medicine of Korea. 1,600 doctors as a membership.
Oh, really?
It's a huge.
It's a pretty big group.
It's getting, I want to be like functional medicine to be more known. I mean, it's still a long way to go here too in the United States as well.
Right.
But like Korea is far behind.
Okay.
Beyond. So I want them to catch up and then
I know I was going to
with
ask
the
you.
United States
So
side by side.
you may not work in this field, but how about the aesthetics? I heard Korea is like #1 in the world for making, lotions, serums, all the aesthetics, the beauty products.
The beauty products?
Yeah. Do you know anything about that?
Not really.
Okay.
There's a lot of people doing already.
Some are coming
great.
here, and I've seen one. I got a demonstration in my office. It was pretty nice. It was complicated though. There's a lot of things you have to use, but the skin was like glass skin when you finished. It was pretty amazing.
Yeah, I mean the skincare industry or like plastic surgery in Korea is really like they're way up there. There are a lot of people doing great.
But what about the inside?
That's
Don't you
the
think
problem.
if you treat the inside and it'll make the outside look better?
Of course. I mean, if Hollywood celebrities they have a skin problem, they start
Inside,
healing their
outside.
gut first,
Yeah.
right?
Yeah, I had a celebrity one time. I had several celebrities, and he was, I don't want to say the TV show, but it was a dancing show. So he had to dance with his shirt off.
Sure.
And he was just getting to be around 40 years old or 38. And he had like, I'm really fat. Don't look at my gut. But he had like this little bit, like you can see it was like a completely six-pack. And there was like this little bit of fat coming out. Like, and he wanted to get rid of it. It was so hard. And it actually turned out
Those
later.
are stubborn, yeah.
Well, he went to a bunch of different doctors, and we did some testing, but I didn't think there was anything wrong internally. But he came up and said, so one guy said he had SIBO.
Okay.
because he was having some symptoms. So he was treated a little differently, and I don't know if it went away though. But it was, they have to be so careful in Hollywood because they have this little bit of fat. Oh, you're out. Next person, come in. So
That's cruel.
he was kind of worried. But I just wanted to bring you on today to show people that, maybe if they want to get some personalized nutrients or do something. But I guess it's mostly Korean, right?
Yes.
Okay. Well, for all the Koreans out there, this guy, he's the best.
Well, thank you for having me on your show. It's always a pleasure to have
Thanks
chat
for
with you.
coming. All right.
Talk to you.
Thanks, Dr. Cho.
Thank you.
Appreciate it. Okay.
Thank you.
Anytime.